everybody. This is Janelle Shear from Stratus Health, part of Superior Health Quality Alliance, and I'd like to welcome you to the Regional COVID-19 Virtual Open Forum today. The purpose of this call is to provide a venue of networking and sharing about COVID-19 concerns and resources across the settings of healthcare. Superior Health Quality Alliance is a fairly new organization, was formed in 2018 with 8 healthcare organizations from across 6 states. We work together to achieve the CMS, or Centers for Medicare and Medicaid Services Quality Strategy aims. And our goal is to work collaboratively to improve the quality of health and healthcare for consumers, providers, clinicians, organizations, and communities that we all serve. All of our sessions are recorded, so if you miss one, you can go back and listen later on. When you get the email from Superior Health about an upcoming session, there will be a link to the Superior Health YouTube channel, and you can find the notes and resources and the previous recording. I want to remind you to mute yourself today when you are not speaking. When you have a question, just unmute yourself, and then please introduce yourself so we know who's talking. A reminder not to include any personal health information. We don't want to identify any patients or anyone specifically. If you're having trouble with Zoom, just chat Elena Smith in the chat box, which is in the lower center of your screen. And if you have any questions that you want to put in the chat, then put it toward everyone. So just remember, we're here to learn all together, so we'll make this a positive learning experience. I would like to introduce our speakers today. So this morning, we have some folks from Minnesota from the Metropolitan Area Agency on Aging. I have Dawn Simonson and Mark Cullen today. Dawn is the Executive Director of the Metropolitan Area Agency on Aging and President for Innovations for Aging. She champions organizational vision and provides strategic leadership resulting in services and programs that benefit older adults and their families in the Twin Cities region and throughout Minnesota. With deep experience in the field of aging, healthcare, and advocacy, Dawn is recognized for her leadership as an innovator and collaborator. Her priorities are to develop networks and other partnerships that support older adults to live healthy and secure lives at home. She has had vast experience and is also past president of the National Association of the Area Agencies on Aging and currently serves on its Mission Forward Committee. So welcome, Dawn. And then the other presenter is Mark Cullen, who is the Program and Advocacy Director at the AAA and Vice President of Strategy and Operations at Innovations for Aging. In these roles, Mark holds responsibility for administering Older Americans Act investments in the 7-county Twin Cities metropolitan area. He cultivates healthcare sector partnerships, drives strategic organizational growth, and grows resources necessary to do the work. Mark also has vast experience in nonprofit organizations and helping people live healthy at home. So welcome to you both today. And Elena will be advancing your slides. So when you're ready for a slide, just indicate that for Elena.
Good morning, everybody. I'll go ahead and get started. While Elena puts the slide deck forward, I was thinking about our conversation this morning and trying to set it in today's times. And I think if 5 years ago you had to present today, the headline would have been the unprecedented demographic shift. We would have talked about the growing older adult population, perhaps with a focus on thinking about older adults and their use of healthcare often being very high need and high cost, and what that creates then in terms of delivery of healthcare and delivery of social services. So that would have been the headline 5 years ago. 3 years ago, I think the headline would have been a growing interest and acknowledgement of the social determinants of health, right? We all would have been newly focused on understanding that the social determinants of health are critical to what happens every day in an older adult's home, to their daily activities, to their daily decisions, and thinking about how that connects to healthcare outcomes. And if we think about perhaps a year or so ago, maybe 18 months, I think the headline then would have been a culmination of this demographic shift, this growing older adult population, our collective interest in the social determinants of health, and then some shifts that we're seeing in policy, particularly by CMS around Medicare Advantage health plans and the opportunities to include payment in Medicare Advantage plans for social services and community supports in really a way that is so much more flexible than has ever been possible before. And we're seeing, I think, some baby steps by among health plans to cover the kinds of social supports that older adults need, again, to make certain that their daily lives are focused on health and well-being. And then today, right? And then we have today. Here we are, hyped in some of our communities of a pandemic, and layered with what I hope is a renewed commitment to minority older adults, Black and Brown older adults and their families, and Native people. And so the information that I'll share with you today is really focused on older adults recognizing these factors: quick, very fast-growing population, consumers of healthcare at a high level, and vulnerable to COVID-19, putting pressure on our healthcare systems in incredible new ways. And then our communities reacting and responding to the needs of minority older adults, driven by the experiences of us all related to the death of George Floyd. So these are times that really call on us all to think about how we can collaborate in the community and meet the needs of older adults in ways that are responsive to what's happening, not only to individuals and their families, but to be responsive to our communities. And so our slides today are really focused on information that you may know already about what I'll call the aging network in your communities. And I define the aging network as area agencies on aging, an organization like ours, available throughout the country. The first home and community-based service program funded at the same time that Medicare and Medicaid were signed into law, within 3 months of each other. And so the Aging Network, created in federal law under the Older Americans Act program, provides a foundation for services and information for older adults and communities across the United States, and certainly in the states that participate in the Alliance. So Elena, let's go to our next slide. Elena, could you advance the slide for me? Yes.
You know what, I'm having a little difficulty with the PowerPoint because I am on the next slide. So let me exit out of it and try something again. Excuse me.
Okay. All right. No problem. So I'll just go right ahead into the conversation. So what we know about the Aging Network in the states that belong to the Alliance, again, is that it provides the foundation for home and community-based supports for older adults and for family caregivers. And the federal program is one that was developed to be readily accessible to older adults more and more targeted over the years to minority and low-income older adults. Older adults, thank you, Elena, older adults in greatest social and economic need. Area agencies on aging across the country are multifaceted, right? But they all share a common core. And the core that they share is that they all are charged under the federal law with providing and developing a community plan for coordinated services. Part of the way they do this is as funding organizations. So we all fund services provided in the community available to older adults 60 plus and targeted towards low income and minority low income older adults. All AAAs, I'll use AAAs for short, provide information and assistance directly. Some AAAs provide care management services. They use their federal funds, or they're contracted by healthcare organizations, or they link to organizations that provide care management. All, as I said, area agencies are funders. We all fund services in the community that are about helping older adults with their daily lives, and we'll look at that in a minute. And then finally, area agencies on aging are advocates for older adults. We advocate on an individual level. We're also engaged in advocacy at the systems level. So our focus has been improving the health and security and well-being of older adults really for decades, since the 1960s. Let's look in a little more detail at the next slide. Elena, those slides are just being ridiculously tricky, aren't they? Yes. So AAAs look different across states because in addition to the core, they often then will add services or enter into partnerships that bring them other revenues. They're also very actively developing services today, particularly in partnership with healthcare. Now, some AAAs also provide some direct services. So you will see some AAAs in some states provide nutrition. They may provide transportation. That isn't so much the case in the aging networks that are affiliated with the states that are part of the alliance. Now, in Minnesota, for example, we can look at some of these differences. In Minnesota, information and assistance, a service provided by all AAAs, is provided through a state-driven approach. So the state is the policy and service developer of information and assistance. It's known as Senior Linkage Line here in Minnesota. In Wisconsin, counties are the primary information and assistance resource. They are known under the federal title, the Aging and Disability Resource Centers, but they do receive funding from the area agencies on aging. And in Michigan and states like Illinois, services are more tailored and they're more individually based in area agencies on aging. Information and assistance services are more individually tailored. In addition to differences, we all know, though, that AAAs practice person-centered services, and in any service that a AAA provides or funds, we want to assure that our services are, particularly on the information side, are accurate, that the information we provide is neutral, we don't favor providers, and that our information is timely. So let's look a little more detail about services at the community level. When we talk about the funding role and the community plan role of area agencies on aging, the services that we're planning around are these. Often for older adults, meals are the services that are often most well-known, both home delivered and congregate dining, rides to the doctor, to other community services, homemaking services, sometimes personal care services, outdoor chore, lawn and snow care, case management, home modifications and minor repair, and legal services. Those are almost always the core services that a AAA will fund and sometimes provide directly in the community. And also incredibly important is that we recognize the role of family caregivers. We know they provide the majority of personal and emotional support care for older adults in their families. And the Aging Network has responded with funding support and program development to help organizations develop caregiver support services. And those caregiver support services are available for any person who is providing care for an older adult or any adult with dementia. And those services are often one-on-one consultation, information and access to services, respite in-home or in group settings in the community, and support groups. I would say that the services you see on the screen are most commonly available in your states, and area agencies on aging have a significant role in planning for these services and funding these services. Let's move on, Elena. Now, what's changed in response to the pandemic? I think what we have seen with AAAs across the country is that we are often trusted and known by older adults and by providers of services to older adults, and they look to us as conduits to information from CDC, states, and local public health. Of really critical importance, what's also changed is that the stimulus bills, both Families First and the CARES stimulus bills, have provided significant new resources to area agencies on aging, primarily in the area of nutrition support, and AAAs are ramping up their funding specifically for home delivered meals across the country. Now, what we also understand is that the needs of older adults relative to receiving groceries, to finding groceries, access to groceries, and greater service ways to get prescription drugs delivered are critically needed now, as are services to help focus on combating isolation. So some of the new money that area agencies on aging have to spend in their communities is focused on these needs. Home delivered meals, growing grocery and prescription drug delivery services, and then a focus on combating isolation. And that focus is often executed relative then to developing programs such as daily telephone reassurance programs or other kinds of supports, including virtual services that are there for family caregivers. So whereas we saw caregiver support groups meeting primarily in person, now we're seeing caregiver support groups meet online. Area agencies on aging are also responding, recognizing that our education and training role in the community has to be carried out differently, and moving then to online webinars and classes, including what is often a significant education role in the community about Medicare and about community resources for older adults. So that's moving online as well. And then finally, area agencies on aging in the states that are participating in the Alliance have all been developing and delivering evidence-based healthy aging classes. And all of those classes in the past were delivered in person. We've been able to be nimble and move to online delivery of those classes. It's in pilot stage right now, but pilots are going well, and we see that expansion will be happening soon. Lena, let's move to the next slide. So how do you connect with your area agency on aging? I think if you don't know, probably the easiest way to connect is just to go to Google, enter area agencies on aging and the name of your state, and you will either find a state website or you will find an area agency on aging association website, and that will give you the direct link to the area agency on aging that serves your community or your county. And the other way is likely to go to the Elder Care Locator. This is a service funded by the Administration for Community Living at the national level. And it's basically a call-in center, a large call center staffed by the National Association of Area Agencies on Aging out of Washington, D.C., and available for adults, families, and providers to link to their area agents on aging. And so the Elder Care Locator is always available either online or by phone. So the next slide then. brings us to some opportunities for collaboration. I think that what we know is that healthcare is stressed today in being certain that you're all providing services to patients during the pandemic. And as we've thought about this in Minnesota, and as we have performed outreach in Minnesota, what we want to be certain we're offering as an area agency on aging is that we can be here when you're seeing older adults in your emergency departments and need resources. If you find an older adult needs access to prescription drug delivery or groceries, an area agency on aging can fulfill that need. The same at hospital discharge. You might find that an older adult also needs help with managing and coordinating their care. AAAs can help with that. The same when being discharged from a skilled nursing facility. We are finding more and more older adults now at hospital discharge might be refusing to go to a long-term care facility because they're afraid of contracting COVID-19 in a nursing facility, and we're providing more in-person or in-depth care coordination telephonically to be certain that they have a care plan and can be safe at home. And then certainly during clinic visits, there are always opportunities there to connect your patients to services in the community. So let's look at our final slide here, I believe, and then we'll move into this is the Minnesota specific information. So specifically in Minnesota, in order to connect your patients, there are some options. One is always calling the senior linkage line. It's available Monday through Friday, toll free. The second is an online referral. This referral has been available for some time, this portal. It's an online referral. The referral of your patient is triaged by the state, by staff at the Minnesota Board on Aging, and then triaged out to an area agency on aging for response. And that can happen within a business day. You can also, when you're connecting either to the senior linkage line or connecting online through the MinHelp referral, ask specifically for a community living specialist in Minnesota. And these are the social workers in area agencies on aging who can provide a 90-day in-depth care plan development and care management service, and then follow that patient for an additional many months and even years. We've developed something specific in Minnesota to be certain that we're providing a way to look for services online and understand how they've changed or what services are being added. And that finder tool is at helpolderadultsmn.org. And then finally, as I mentioned before, we've worked hard to be nimble and address the fall prevention and disease management needs of older adults by creating online evidence-based healthy aging services. And I think at this point, I'll turn it over to my colleague, Mark Cullen, who will take us through the remainder of the slides.
Yeah, happy to do that. Thanks again for the opportunity to speak with you this morning. Dawn, before we go into the information that's more specific to Juniper, there are a couple of questions in the chat that are more about AAAs generally, and I thought I could just address those with your input real quick before we turn our attention. Jerry Hineker asked if the AAAs are able to help with meal and grocery delivery in rural areas, and said that in many areas, grocery stores or Meals on Wheels deliver within city limits, but don't reach rural areas. And what we know, at least in Minnesota, is that some of our service providers, Lutheran Social Service of Minnesota, as an example, do deliver frozen meals to rural areas, and they'll deliver several frozen meals, like a week's worth of meals in one drop. They're in different states handle these things differently, but there are companies like Mom's Meals and others that will do similar service delivery in rural areas, either frozen or even in some cases a hot meal, depending on the proximity to the provider. AAAs develop these service networks in their regions and at the local level. So there should be some response in every AAA to a question like this. But the specific, how the AAA deals with that is different in different areas. Dawn, would you add any other comment to that?
No, thanks, Mark. That's complete.
And then the second question here before we turn our attention is from Nancy Miller, and it's about how education is delivered to those without online access. And I think that really then leads me right into this next couple of slides. So Elena, if you would move us into that next slide. So what we've done in Minnesota is, Dawn was alluding to the evidence-based health promotion and disease prevention funding that all AAAs across the country administer. In Minnesota, we've taken a different approach here. Because there really is not much funding available. To give you some sense of the scale, at our AAA here in the Twin Cities, we do about $8 million of grants and contracts for services every year in the Aging Services Network. But we do about $164,000 for evidence-based health promotion and disease prevention. In other words, the amount of federal money available to support these kinds of programs is far, far lower than it is for example, meals programs. So what the AAAs in Minnesota have done is that we've come together to bring our networks together to form a service provider network for evidence-based health promotion and disease prevention. This work began really in earnest in 2016 and 2017 when we started forming these networks and building our work together. And we've done this under the brand name of Juniper. And the idea here is that juniper plants have a deep series of interconnected roots, and we think that speaks to some of the ways that AAAs and their partners in their local communities work together. And so what we've done is we've centralized the sort of single point of contracting, the referral mechanisms, the business end of things. We've centralized that into one spot so that folks in healthcare have one organization to talk to, and you don't have to talk to all, for instance, 164 providers in our current network and negotiate agreements individually. We can bring you the whole network in one shot, and they then deliver programs, evidence-based disease prevention and health promotion programs in communities all across the state. These programs are probably programs you've heard of before, right? So they're like a diabetes self-management program, a matter of balance, Tai Chi Quan. And we've done some innovation just in the last few months to bring a new program called Social Connect into our mix. That program is unique in that it is not evidence-based, but it's intended really to respond to the social isolation that we're experiencing as a result of COVID. And it gives program participants really, a space to come and talk about stress management. There's some light exercise. But if I'm just being candid with you, it's, the point of Social Connect is really just to give people a space to talk to one another. And at a time when many older adults are just isolated. And if we watch the news, that's likely to continue for some time because the programs are targeted. Our programs are targeted at the most at-risk population, right? People with diabetes, breathing problems, maybe a fall risk. And these are the people that, when we think about the public health emergency, these are the people we're most worried about. In terms of volume, last year we did 5,644 participants through any of our programs. So we're seeing quite a bit of scale. We ran 562 classes last year with 164 organizations. And one of the things that makes me so optimistic about our future and grateful for our community partners is that we have 850 class leaders, and these primarily are lay leaders. They're either trained staff in the organizations or they are volunteers. A significant portion of them are just volunteers, people who are retired and want to give back. In many cases, they are people who have been through the classes themselves, and that's probably the most powerful way to deliver these classes. When you find somebody who, has dealt with something like chronic pain and learned strategies in the class and said, I'd like to help others. I want to become a teacher and help others. So we've seen some of that in our work as well. Elena, if you could move me to the next slide. Thanks. So this gives you a sense of what the classes are. So I mentioned the diabetes classes. There's a chronic pain class, knowing, in Minnesota, I'm not sure about the other states, but in Minnesota, our state legislature has significantly limited the ability of a physician to prescribe opioids. And I guess this information is, pre-COVID, so now it seems like a forever ago, but a few months ago anyway, the wait to get in a pain clinic at one of the large health systems here in the Twin Cities was about 6 weeks, unless you had a physician that said, hey, look, this patient's got to get in right now. So, that's coincidental, but the timing is that, our chronic pain class actually lasts 6 weeks. And so for that physician that, has a patient that they'd like to get into a pain clinic, but the wait is going to be 6 weeks, this gives the physician an option. What I think, the physician benefits here, because if the physician says to the patient, I'm sorry, I can only give you a week's worth of opioids. And then I don't have anything for you until we can get you into the pain clinic, and that's 6 weeks away. The patient may perceive the physician as, uncaring, not sympathetic to the challenge that the patient is experiencing. So we think that pairing a chronic pain class in a clinic setting, or at least giving a referral, gives the physician another tool in the toolbox to be able to help the patient and increase the patient satisfaction, while helping with non-pharmacological interventions to maybe give the patient a shot at doing something without opioids. We do have quite a bit of work in falls prevention as well. I know in a lot of the states here in northern states, fall risk is a significant problem. We've got a matter of balance, the Tai Chi Quan, moving for better balance and stepping on, that are really focused around falls prevention, helping to reduce the costs also associated with those falls. So we see that most of our program participants actually take either Tai Chi or a matter of balance. In fact, well over half of all participants take one of those two classes. They're very, very popular. And then you'll note the asterisk there, where we have culturally appropriate Spanish versions of the programs. One of the things that's interesting about the Tai Chi class, there's no written curriculum, there's no manual, it's delivered verbally. So in some cases, the program is delivered in Lao because all the attendees are Hmong, and they all speak the same language, and there's no need for written material. So it's you can tailor the class and the curriculum to the needs of the participant population. That's one of our flagships there. Elena, would you move me to the next slide? So here's an opportunity for us to work together. We have a HIPAA secure platform through which we can receive your referrals. And we'd love to do that in Minnesota. And so if you have patients that might be a good fit for any of these classes, you can make a referral right through our referral portal, and we'll get connected. We have a group of staff that receive the referral, and they turn that around usually within a business day. They'll call the patient, find a class near the patient, and get them enrolled. And then we'll communicate back to you, letting you know that we caught the referral and we took an action. Next slide, please. And that's our contact us slide. So that's how you get a hold of us. On the Juniper side, we are just in Minnesota. We do support a network similar to ours in North Dakota and another in Maine, but we don't have a Juniper-like entity in other states on this call. I'll put our URL for the Juniper website in the chat so that you can just click on that, and I'll do that now. And happy to take any questions you might have.
Thank you so much, Mark and Don. I see we do have one question in the chat. Do you know, does Michigan have a Juniper similar program?
They do. In fact, I was just on a call with a group from Michigan State, Michigan State Extension, sorry. Was it last week? All the weeks blend together now, don't they? I think it was last week. They do have a set of programs like ours. They are not as, they're not as geographically diverse as we are. In other words, I don't think they cover the whole state, but they do offer similar programs in a similar approach. So Michigan State Extension would be where I'd reach out.
Okay, thank you. And I see that Barb and Mary have posted links to the Michigan and Wisconsin Area Agency on Aging resources. So thanks you guys for that. Let's open it up for just for questions before we break into our state-specific networking time. So if anyone has a question, you can unmute your line, phone, or computer, or put it in chat. And while we're waiting, I actually have a question. So what I'm wondering is, I know healthcare can refer, but how would a regular consumer learn about these resources?
Well, folks, in terms of, and so Janelle, are you asking about Juniper, or are you talking about the AAA services more broadly?
Well, really, any of them. You know, if I'm an older person, and you know, how would I find out about any of the services?
Yeah. So from the broader, so let me just take the broad AAA perspective, and then I'll bring it down to the Juniper perspective for a more narrowly tailored answer as well. From the broad supportive services, including meal delivery and those kinds of services that are offered in community settings, the service provider network advertises the services themselves. And so what you'll often see is like, oh, well, you know, one great example here in the Metro is Metro Meals on Wheels. And so they receive state and federal funding, AAA funding through us, right? So Dawn and I are responsible for passing the money to them to pay for the meals, but it looks like a Metro Meals on Wheels program, and their regular advertising is how people find out about those meals. People can also call the senior linkage line, and you know, in other states, the lines that are similar to those at either a county or state basis. In Michigan and in Wisconsin, even in Illinois, every state has some kind of an information and assistance line or process. And so consumers can call those lines and find out about what services are available in their area and, you know, how to access those services. So that's there as well. In Juniper, we've been doing, you know, we're more responsible for the delivery, direct delivery of the program. And so we've done Facebook ads, and we've been working to help care coordinators, someone's care coordinator, understand the value of the class and receive referrals. We've been reaching out to healthcare providers and doing many calls like this to promote Juniper as a good intervention for patients who might be struggling with diabetes or chronic pain or potential for fall risk. Dawn, would you have anything to add?
The only thing I would say is just qualify just Mark's statement a little bit. So I think Minnesota is relatively unique in terms of a really robust statewide information and assistance line. The senior linkage line is virtual. The state runs a virtual call center that's staffed by area agencies on aging. Wisconsin, the go-to organizations are the county-based ADRCs. In Michigan, you know, each AAA basically has some form of information and assistance line. I am not as familiar with the Illinois presence. When in doubt, go to the elder care locator and call the elder care locator. They will connect you to the AAA closest to the person who needs services.
Dawn and Mark, this is Eva from Security Health. A quick question, as it relates to a healthcare organization's perspective, is your organization involved in any community coalitions that maybe come together to identify, assess the needs of our communities to be much more proactive? And also, do you have, I guess, maybe even specific numbers or channels where healthcare providers like case managers can go directly to once they've identified a need of a patient?
Mark, do you want to take the question about community coalitions that we participate in? For example, some of the work that our Elder Care Development Partnership staff does, whether it's the Mental Health and Aging Network or the work we've been doing in North Minneapolis on housing. Could you say a little bit about that?
Right. So those examples are here at the Metro Area Agency on Aging, but it's very common for a AAA to be deeply rooted in any number of community coalitions that, it feels like I spend an awful lot of my life in community coalition meetings, or my staff is also participating in those meetings, often leading, facilitating those meetings. And so AAAs are often very deeply involved in all kinds of community type meetings, including meetings that are focused around public health initiatives or building out service provision for patients. There are phone numbers for providers or care coordinators to call. Again, that senior linkage line number here in Minnesota is often used in that way. And then our number for Juniper, we have a direct line for the Juniper classes as well, or through that referral portal. But I'll throw our Juniper number in the chat along with our email address, because we often get inquiries that way as well. So those direct lines are also there. But yeah, definitely in contact with providers via phone and certainly through many community collaborations as well. And if there's one that you have an idea about that we're not at, we'd be happy to entertain how we might be able to participate once we are all able to leave our homes.
Yeah, or even earlier.
Yeah.
I would say that we are, we're more embedded in the social service community, certainly, than we are in partnership with healthcare. And there's definitely room for more collaboration and interaction. And sometimes we're simply just not invited to those tables. We would love to be invited.
Mm-hmm.
I had a question that's with Superior Health High in Michigan. Used to live in Minnesota, so I get confused sometimes. So you were talking about a lot of things going virtual now. And I was wondering, again, we're tasked to expand a little bit to rural populations. And I know sometimes they're talking about Wi-Fi connectivity and older adults. I know, some older adults don't have access to certain technology and things like that. Are you finding, even in the metro area, any issues with that as you start having some of these groups meet more online than they were in past? Issues around that connectivity?
Yeah, for the Juniper programs,
mitigating those then.
Yeah, so a couple of different ways. So of course, for the Juniper programs, for most of these programs, the programs are evidence-based and licensed by the groups that have developed the curriculum and the evidence base for those programs. And in most cases, they have not ever allowed for an online class delivery until COVID hit. So we are now like 3 months into testing what it's like to do programs online. And I have to say that, I'm pretty optimistic about how this has come together. One of the ways that we've tried to address technology and issues around knowing how to use technology is to start with a session, what we call a session 0, where we teach people basically how to use Zoom. So the first class is how do you use Zoom? And we're using a HIPAA secure Zoom platform. So we've upgraded the Zoom subscription to make sure that it's HIPAA secure so that we're compliant with HIPAA technology as well, or HIPAA's technology requirements as well. So that's one way that we've addressed it. We have, though, of course, seen, some differences both in rural areas and even in the metro communities around both access technology and then also to, folks' skills using technology. The classes, in most cases, and again, we're very early into this, but we're seeing quite a bit more participation on a class by class level. So it's actually going online has made these classes, again, hard to say because we're very early, but it feels like this might have made classes more accessible to people because you don't have to leave your house. So that's, I think, been in some ways that has been a greater benefit to populations who might have been marginalized the other way. So that's been good. Some of these classes, folks can participate by phone. And so I hadn't looked, Janelle, at the invitation for this meeting, but I know in our Zoom meetings, each meeting comes with a phone number. So people can just dial in And that's another way. So if you don't have an iPad or some way to join via video, a phone can work just fine for some of these classes. And so we plan to go forward with that as well. There are some classes that would require a video connection because there are movement, like the Tai Chi class. You have movement in shapes that you're doing that you're mimicking from the class leader. So you would have to have video access for those. But we know that and so I grew up in South Dakota. I grew up in a really tiny town in South Dakota. We still have the family farm, and I'm regularly FaceTiming with my aunt and uncle who are in their 70s. So folks have access to technology even in these very rural communities, but sometimes that access is spotty. And so in those cases, we'll have a phone intervention. But I think technology access is an awful lot better than it used to be. And the Pew Research does a pretty good job telling us about the skills that folks have around technology and how that's been increasing year over year. Folks who are older are getting better and better and better at using technology.
I was just going to add too that as the restrictions around social distancing are relaxed or go away, and we think about access to programs through technology, there may be ways too to use places like libraries or township halls or others where classes can still be delivered online, but older adults can come to a known place in their community and leaders can deliver them online to people gathered in a place that really just needs a relatively good sized space, and that's about it, and a little privacy.
Yeah, we had, one example that is we had done that just before COVID broke. We had just started the very first pilot, and it was delivered via, it's like a distance learning platform that was located in a clinic, and then the clinic had satellites, and so people could come to the clinics, and they could join there. And then the one main clinic in St. Cloud was delivering the actual class out to those clinics. So that's one option that'll be available to us, I hope, when all this is over. Again, all this goes back to what the program licensors will allow. But we're very hopeful that we're going to be able to demonstrate here that we've actually increased access for many populations that just didn't have it before because they weren't able to drive several miles to attend a class.
Great. Thank you. Thanks.
Yeah.
Yes, there's always some good that comes out of challenging situations, right? So that really demonstrates it. And it sounds like you'll probably still continue to offer online courses even when people can come together.
Well, we'd sure like to, absolutely.
Well, thank you so much to both of you for presenting today. We have about 13 minutes or so left for our state-specific rooms for networking. You probably noticed in the chat for Wisconsin and Michigan, some resources have been put in there as well. Elena did just put in a link to an evaluation that we'd like you to complete really quickly before you go into the state-specific rooms. Elena, will you please explain the process for getting into your own state room?